Welcome to today's video on the benefits of glucosamine sulfate for joint health. Suppose you suffer from osteoarthritis or just general joint pain and stiffness. In that case, you may have heard about using glucosamine as a nutritional supplement. But what exactly is glucosamine? How does it work, and what does the science say about its effectiveness? In this video, we'll explore the science behind glucosamine sulfate and how it can help support joint health and mobility as we age. We'll discuss clinical studies, dosage recommendations, and potential side effects. There's a lot of confusion and misinformation out there about glucosamine, so our goal is to summarize the critical research and help you understand the real benefits and limitations of this popular supplement. Let's get started. Glucosamine sulfate is one of the most common over-the-counter supplements used today. It's commonly used to treat joint pain and stiffness associated with osteoarthritis. Osteoarthritis is caused by the breakdown of cartilage in joints over time, which leads to pain, swelling, and reduced range of motion. Cartilage acts as a cushion between bones, allowing them to glide smoothly over each other. However, in osteoarthritis, the smooth cartilage surface becomes rough and damaged. It causes the grinding, popping, and pain felt in the joints. Glucosamine is a natural compound found in healthy cartilage. It is vital in building cartilage and synovial fluid, which lubricates the joints. As we age, our bodies produce less and less glucosamine. By supplementing with glucosamine sulfate, the idea is to give the body additional raw materials it needs to maintain and repair cartilage. There have been numerous clinical trials evaluating the effectiveness of glucosamine sulfate supplements. Several of the highest quality problems found modest benefits. For example, one 6-month study of 318 people with knee osteoarthritis found that 1,500 milligrams of glucosamine sulfate per day reduced pain and improved function more than placebo. The effects were similar to low doses of non-steroidal anti-inflammatory drugs like ibuprofen. Another 3-year trial in 212 people found 1,500 milligrams of glucosamine sulfate slowed joint structure deterioration compared to placebo. So, while the pain relief benefits are modest and comparable to NSAIDs, glucosamine may help protect cartilage from further damage. It is crucial for long-term joint health. That said, other high-quality studies have only sometimes produced consistent results. For example, a sizable NIH-funded trial found glucosamine hydrochloride and chondroitin sulfate supplements were no better than placebo for reducing knee pain. So what's the deal? Does glucosamine work or not? Well, the benefits do seem to depend on several factors. First, glucosamine sulfate seems more effective than glucosamine hydrochloride. Many studies showing benefits use the sulfate form, which appears more bioavailable. Second, higher doses around 1,500 milligrams daily work better than lower doses. Third, studies longer than 6 months show more meaningful benefits, suggesting it can take many weeks of continuous use for glucosamine to impact cartilage and lubricating fluid. Finally, the evidence is more substantial for glucosamine's effects on knee osteoarthritis than hip or spine OA. One reason is glucosamine is difficult for the body to transport to avascular structures like spinal discs. Regarding safety, glucosamine sulfate is well tolerated with a low risk of side effects. The most common side effects are mild gastric upset, constipation, or diarrhea. Glucosamine may also interact with diabetes medications or high blood pressure drugs, so consult your doctor if you are taking these. Glucosamine sulfate supplements show moderate benefits for relieving osteoarthritis knee pain and possibly slowing joint cartilage breakdown. To get the most help with minimal risk, use glucosamine sulfate at doses around 1,500 milligrams per day for at least 6 months duration. See your doctor before taking glucosamine if you have diabetes or take blood thinners. While not a magic bullet, overall glucosamine appears helpful in supporting joint health, especially when combined with other natural approaches like weight loss, exercise, anti-inflammatories, and avoiding common overuse and injury. That summarizes the critical research on glucosamine sulfate for joint health. While benefits are modest compared to medications, glucosamine offers a low-risk option to help improve joint pain and function and slow structural disease progression. As always, talk to your doctor to see if glucosamine supplements suit your everyday health needs. Thanks for watching, and be well. Blackmores Glucosamine Sulfate Joint Health Vitamin Tablets are a supplement that contains the compound glucosamine sulfate. Glucosamine sulfate has been studied for its potential benefits for joint health, especially knee osteoarthritis. Clinical studies have shown it may help provide mild to moderate pain relief, improve joint function, and slow the breakdown of cartilage in the joints. It appears safe to use with minimal side effects. The benefits are most notable when taking 1,500 milligrams daily for at least 3 minutes 6 months. There is some conflicting evidence on efficacy, but overall, glucosamine sulfate shows promise as an oral supplement to support joint health as we age. People with osteoarthritis who take glucosamine sulfate may experience reduced joint pain, better mobility, and potentially slower progression of their condition. As always, speak to your doctor before starting any new supplement.
Remember to subscribe and don't forget to hit the bell icon to never miss an update from Health Guide Zone.